Hi, I'm Dr. Mike Milligan. I'm here with Dr. Lon Jones of Plainfield, Texas, developer of the Xlear nasal spray. Lon, thank you so much for being with us.
Pleasure.
Tell us a little bit about, briefly, your history, which led into then you developing the Xlear nasal spray.
That probably starts with before medical school.
Okay.
And before medical school, I was at the University of Washington studying the history of science and ideas.
Okay.
And that makes it so you ask sometimes uncomfortable questions as you continue studying other areas. And when I was in medical school, I was always thinking and sometimes asking, and not always in pleasant circumstances, why are we doing this way?
Okay.
And the reasons sometimes were disturbing, because we do things this way because grandma did them this way. And in healthcare, that means that we're doing something because of an idea that grandma had a long time ago. And in grandma's age, that was called a humoral system. And the definition of health in humoral medicine is a balance of symptoms. Now, we've progressed beyond humoral medicine. We don't look at blood and bile and black bile and the other things that the humoral medicine people did, but we have scientific things that we look at, like our blood pressure, like our level of cholesterol, like other symptoms that sometimes we have that are disturbing and that need to be in better balance.
Right.
And sometimes our body has to go out of balance in order to deal with the problem. And a fever is an example of that.
Let's use a couple of examples.
And a fever, if a person has an illness, a fever makes it so their immune system works better and stronger. It is harder on the invading organism, whether that's a virus or a bacteria, to multiply. So a fever helps you deal with this problem. And we can take snakes, for example, and artificially infect them. And if we prevent them from developing a fever, from moving into the sun to warm themselves up, more of them die. If we artificially experiment with rabbits and infect them and give them the drugs that we use in us to treat the fever, more of those rabbits die.
Yep.
Now, we don't seem to be able to learn from rabbits because we still are rampant in our treatment of fever.
Right.
But a fever in this case is a defense. And if you hobble the defense of your favorite football team, they're going to lose.
They're going to lose.
Same with us, unfortunately. So what other defenses do we have? Our major systems that are open to the outside have these defenses.
Right.
And our GI tract is a major one. And when I graduated from medical school, it was about the same time that they were developing oral rehydration to treat cholera.
Right.
Cholera is an example of a killing illness because you have diarrhea that dehydrates you rapidly, and people die of dehydration.
Right.
Cholera doesn't kill people. It's the defense that wipes out their fluid supplies in their body that kills people. And oral rehydration is able to keep that tank full so that they can successfully wash out the cholera bacteria and live through it. And it's a very successful. 10 years of oral rehydration saved more lives than penicillin did in 40. Now, it's interesting that that's a drug claim. Anything that saves lives is a drug. And we don't know about oral rehydration in this country as much as the rest of the world, where the World Health Organization pushes it.
Sure.
And probably because of that one element. It's not a drug. You can't make drug claims saving lives for something that isn't a drug. That was a problem for me. And yet I knew it, and oral rehydration played a very prominent role in my practice, and it was the most useful thing I would give to people.
Right.
You know, when you need extra fluid, this is what you drink: salt, sugar, and water in the proper proportions.
Okay.
And so that idea is there of helping defenses.
Right.
That fits in with my osteopathic training.
Right.
because in osteopathic medicine we believe that the body can heal itself if it has the things it needs to do so. And then we look at upper respiratory problems. And early on in my practice, I would use antihistamines and decongestants because the detail people come and dump them on your doorstep. So when I would get congested, I would take an antihistamine, and it made me worse.
Right, just what you shouldn't do.
Just what you shouldn't do.
Block
because,
the bodily defense
yeah,
system.
right.
Okay.
It didn't make sense. So I started using saline. And saline helps, but it doesn't help a whole lot.
Right.
And then I met this woman after a divorce, met this woman who had a granddaughter. And when granddaughter was 3 months old, they put her in daycare so mom could go back to teaching school. And she started getting ear infections.
Right.
Now my girlfriend, grandma at that time, used to teach special education. And 40 years ago, she recognized that the kids in her class who were smart, but had trouble learning language and sounds in language, had all had tubes in their ears when they were babies.
Right.
She said, "What's the connection?" And when her granddaughter started having that problem, she went a little bit ballistic, and she said to me, "If you really cared about kids, you'd find a way to prevent this problem."
Okay.
Well, I can't say that I don't care about kids. I've got enough of them. And so I went looking.
Okay.
And one of the things I found was a study done in Finland on kids with chronic ear infections. And in Finland, they use gum with xylitol.
Right.
Long story, and you know about xylitol.
40%.
You know what it does to prevent tooth decay.
Mm-hmm.
And 40% of these kids that were chewing gum to prevent the tooth decay
With xylitol.
had 40% less ear infections.
Right.
So I went home joyous. I said, all we need to do is start her chewing gum. She doesn't have any teeth yet. Go back to your drawing board. So
we're back at the drawing board.
Went back
what
to
did
the
we
drawing
come up
board
with?
and said, you know, the bacteria that cause these ear infections
They're in the nose.
are in the back of the nose, yeah.
Okay.
So why don't we put it there? So I got a bottle of saline and we put some xylitol in it, and my pharmacy mixed it up for us, and we gave it to mom and dad and daycare workers, and the ear infections went away.
Right.
I started using it in my practice, and kids with our granddaughter's kind of problems used it regularly. I looked at them after a year, and the incidence of their complaints from before and during the time they were keeping their nose clean, 90% less ear problems.
Wow.
So ear problems we commonly look at as a rite of passage, you know, in little kids. They're going to have ear infections. But those ear infections are problematic because a certain number of them, every time a kid has an ear infection, there's fluid in the middle ear. And the middle ear is where all the little bones are that transmit sound from the eardrum to the brain.
Right.
If that area is full of fluid, those sounds don't get transmitted correctly. And the other part of that is that from developmental psychology is that babies, when they're learning sounds, there's a window that is optimal
Window
for
of
that.
opportunity to.
Yeah, and that window is from 6 months to about 2 years.
Okay.
6 months gestation.
Right.
So even before they're born, they start learning these sounds. And if they don't pick up the sounds, that's the same window, you know, after baby's born. You have that window in the uterus, which is fine, but after the baby's born, and they start being exposed to these bacteria and viruses that cause the middle ear infections, that's about the same window for learning those sounds.
Right.
So that's the problem that Jerry was picking, my wife was picking up, my wife now, my girlfriend then,
Right.
was picking up in her special ed class. And so how do you deal with that? Well, there isn't a good way to deal with it. The way to deal with it is to prevent the problem.
Absolutely.
And that's what we can do with this nasal spray. And the other thing about the nasal spray from a dental point of view, let's talk about that for a minute, is a lot of times kids have allergies or things that block up their nasal passages, and so they breathe through their mouth.
Right.
And
Terrible
mouth breathing is a big problem.
It's a big problem.
Yeah. And when a child mouth breathes, it deforms their face, it pulls their dental arch together, it raises their palate, so that their airway, their nasal airway, where they should be breathing, is more compromised. And then they get to be 14 or 15 and their teeth are all messed up and they need to go to the orthodontist and spend $1,000 or so
And that doesn't
dollars.
even do the job, because
Yeah.
they actually need their palate developed to
Yeah.
improve their airway.
Right.
And then speech therapy and tongue
All the rest.
swallowing therapy, tongue
Mhm.
placement therapy. So we can prevent a lot of that if we use
Keep your nose
the-
clean.
keep your nose clean and use the Xlear nasal spray in youngsters. What age can we start?
Well, Heather was 3 months.
3 months. And
Yeah.
then how old?
On a baby, this is a sample bottle. And when you spray your nose, look at your toes, because you want to spray it back your nose, and that goes toward the back of your head. So it's as easy as that. In a baby, hold them up in your arm, spray each side of their nose, lay them down, change their diaper, and do that before every diaper change. And when you lay them down, that allows it to go back to the back of the nose where it's effective, because babies can't obviously sniff when they spray.
Wow.
But if you do that at every diaper change, your baby's nose will stay clean. Oftentimes when they get to be 2 years old, you know, they get a little bit argumentative. I'm not going to do that. You know, well, make a deal with them. First of all, be a good example.
Right.
And keep your nose clean,
Right.
mom and dad, and brother and sister. Who should use it? Everybody should use it.
Okay. Everybody, all ages.
Everybody, all ages, because one of the things that has happened in our society as we have become more civilized is that we have moved into centrally heated houses.
Right.
Well, when you turn the heater on, you're lowering the relative humidity.
Mm-hmm.
When you turn the air conditioner on, you're pulling water out of the air. Either way, you're lowering the humidity in the air that we breathe.
Right.
And lowering your humidity makes it harder for your nose to work properly.
Lon, how would we get in touch with you or Xlear for more information?
I have a website.
Okay.
I have a couple of books. The easiest that talks more about xylitol and what it does is a book called No More Allergies, Asthma, or Sinus Infections.
Okay.
A book that talks about the principle that we talked early on about honoring our defenses, is the Boyd's and the Bees.
And Boyd's and the Bees. So what's
Boyd's,
your website?
Boyd's is B-O-I-D-S.
Okay. Oh,
And
Boyd's and the Bees. Okay. So
that's based on a development by a guy named Craig Reynolds, who has a computer program that models a flock of birds behaving as one.
okay.
So that's a complex adaptive
birds.
system, and we are complex adaptive systems.
Absolutely. What's your website?
Website is Common Sense Medicine.
Okay. CommonSenseMedicine.com.
CommonSenseMedicine.org.
.org. CommonSenseMedicine.org. Go ahead and get to that website. Learn this. We can prevent so many problems for these young people as they get older. Prevent all the problems associated with it. Lon, thank you for all you've done, and appreciate so much you being here with us today.
You bet. Thank you.